Okay, so welcome you all to the Diagnopool Lab Mentorship Program webinar number 6. It's my pleasure and honor to welcome you all to the 6th webinar. And we are today discussing a very deceptively simple topic. The topic is on ethics in the medical laboratory. Am I audible to everybody?
Yes, sir.
Yeah.
Yes, sir.
All right. So ethics, we speak of ethics and then we suddenly get lost. What is it? Even during NABL assessments, if you see the NABL assessor asks that, have you had a training on ethics? Have you had a training on confidentiality? So we do conduct some trainings, and then as a period of time in my own lab, I realized that the training I was conducting was something not very suitable or not complete. That's when I realized the importance of this topic, and to have this topic dealt, I felt there was no better speaker than my good old friend, Dr. Keyoor Gautam. I have known him from my post-graduation days in KMC Mangalore. Dr. Keyoor is a little bit about Dr. Keyoor before we start. Yeah. So Dr. Keyoor is our guest speaker for today. He has done his MD Pathology from Kathmandu University, Kasturba Medical College, Mangalore, from the year 2007 to 2010. He has undergone training in oncology and oncopathology in the year 2012 from Tata Memorial Hospital, Mumbai, India. He is a clinical pathologist and a professional member at the American Association of Clinical Chemistry. He has established the first ISO 15189 accredited pathology laboratory in Nepal. So that's a really big achievement. And he is credited with the awareness on the importance of accreditation in laboratory medicine in ISO 15189. His areas of interest are many, and many research publications are there to his credit, but he has worked especially on research and awareness activities on lead poisoning, especially in children. Apart from that, I know Dr. Keyoor is a very humble person, and he has been very ethical right from the PG days. I have observed him. He's been very ethical, so I felt this topic, ethics, could not have been dealt in a better person than Dr. Keyoor Gautam. I will end my presentation and over to Dr. Keyoor Gautam.
Zubair, can you, yes.
Yeah, we can hear you.
Can you see the slide now?
No, we cannot.
Right now, no.
Yeah, we can see your screen.
Sorry, I have a little bit of a problem here. I'll try to once again log in. Now, Zubair?
Yeah, we are able to see. Yes.
Okay. Shall I start?
Yeah, please start.
Yes. First of all, thank you very much, Dr. Zubair, for this opportunity to share some of my thoughts on ethics in laboratory medicine. And well, this is a very nice initiative of yours to be sharing among laboratory professionals on different issues and learning from each other. So I'll start my presentation. So when we talk about ethics, most common thoughts that come to us, I mean, these are some of the things which were, asked to people about their opinion on ethics. And most of them have said that ethics means it's my feeling about what is right or wrong. Some would say that it's my religious belief. Others would say ethics is something which the law requires, and some other would also say that it's a behavior that our society accepts. So there are so many meanings that we can put to ethics, but then actually what is the meaning of ethics? So what does ethics mean? Ethics is based on well-founded standards of right and wrong that prescribe what human ought to do, usually in terms of rights, obligations, benefits to society, fairness, and specific virtues.
Your screen is not moving.
Is it moving right now?
No, you can go for the F5 presentation mode.
Okay, just a moment. Now?
F5 you can press on. Then
Yes, Zubair. How about now, Zubair?
no, you can just change the screen once. Go to the next slide.
Now?
So what you should do is you should press F5. F5 will go for the full screen presentation here.
Okay, just a moment.
Yeah, now it's moving.
Now it's moving.
Yeah.
But can you see the whole screen or just, I think,
it's okay.
is it the whole
problem.
screen?
Yeah.
It's okay.
Not a problem.
Okay. Is it okay to present like this?
Yeah. Yeah, please go ahead. No problem. Yeah.
Okay. What can we say about ethics is, it's the well-founded standards of right and wrong, and usually this is usually formulated from the society. So this is pretty vague, but I would like to go into more detail so that you understand what ethics is. Now the question comes: is ethics and moral the same? So morals and ethics, some say it is the same thing, vice versa. But in fact, those are two different entities that we should also discuss further. So first, I would like to talk on ethics. So actually, when you talk about ethics, it's a rule of conduct recognized in respect to a particular class of human action or a group or a culture which is accepted there, and then ethics is something which the society builds up. It is an external thing. We do it because society says it is the right thing to do. So that is ethics. It is also governed by professional and legal guidelines within a particular time and place, especially guidelines in terms of research, even in terms of medicine or laboratory medicine. So there are legal and professional guidelines. Ethics is what is good. It is objective, it's rational, it's clear cut and consistent. So these are the what ethics stand for. So when we compare this with morals is something which you personally believe. And when I would like to put it across in a very easy way, moral means, I think this is what I did is good. I have done good, and that's what I feel. So, what I feel internally, that is moral. So, when we talk about moral, it is more of individual internal thing. We do it because we believe in something being right or wrong. So it is not the society that has to accept it, or it is not something that the culture, it is in the culture, it is something that we feel like it is right or wrong. So morality transcends from cultural norms also. It's your feeling. Sometimes you say that was my gut feeling, that's why I did it. So something, if you do it from your gut feeling, you thought it is right, it may not be ethical. It may be moral from your part, but it may not be ethical. So that's why moral is subjective, non-consistent, because it depends on where you are, your circumstances, and then it is not clear cut also. So I hope we have understood what is moral and what is ethics. So ethics is what we were going to discuss today in laboratory medicine. So what is right and what is wrong is always a dilemma. As I said, moral would say that I feel like this is right, but doing the right thing would be ethics. So in this time and age where you have seen, sadly, I should say, in laboratory medicine, 4 years back, I should say, like till 2019, laboratory medicine was not very well recognized. It was recognized, but it was not appreciated well. Now, what happened is due to COVID conditions, now everyone thinks that there is a lot of money in laboratory medicine, and there comes the role of ethics. Because when people invest in medicine or laboratory medicine or any healthcare system, it should not be directly for profit, because if that is oriented, profit oriented, then ethics is always compromised. And well, so how did ethics evolve in medicine? This is also something which I would like to share with you. It's not that our medicine, I mean, we are in the same subcontinent. I'm in Nepal. Most of you are in India. So it's not that our traditional medicine did not have ethics or morals. It had both. But now, this is somewhat from Western medicine. I just wanted to share with you how the initiation of more modern ethics was brought into the existence. So it was during the World War II. After World War II, what happened is there was a lot of casualties, and there was a lot of illegal researches done on the prisoners, on the captives, and this was pretty bad. So in Nuremberg Code in 1947, there was a certain code oriented towards research activities which went in during the World War II. So this initiated the modern ethics, the initiation of modern ethics. After which, within a year, there was a declaration from Geneva, which talked on physician's oath. It is not the Hippocratic oath; it is a physician's oath, and this was accepted by the World Medical Association also. Then came Declaration of Helsinki now in 1964, which was a combination of the first two. And finally, Belmont report is the one which we follow nowadays. It is simplified and it includes both biomedical and behavioral research ethics. So this is the one which was introduced around 43 years back, and this is the one which we are following right now. Dr. Zubair, am I audible? Is it okay?
Yeah, it's fine. We're all catching up.
Okay. So this is the Declaration of Geneva. It's they have more spoken on the code of ethics of physicians. Now let's come to the point about our subject matter, laboratory medicine. So do we need laboratory ethics in laboratory medicine is the question. As I have said, sadly, people did not understand medicine. Nowadays also, if you go to rural areas and you ask about a lab, they are well versed about PCR. Everyone knows, the entire population knows PCR, but do not know that even it's conducted in a lab. So slowly now they know about lab, but then the sad part is before it was not emphasized much. Now it is taken as a profit making like a commodity. It has shifted from health care to somewhat like a commodity marketing. So sadly, it's our responsibility to advocate that ethics should be there in laboratory medicine. Now, adding to this, we all know that more than 70% of let's say preventive medicine, diagnosis, treatment, and follow-up are dependent on laboratory test results. May it be laboratory or diagnostic in the sense of, radiology, but then mostly it is laboratory medicine that medicine is dependent on. And even 2-3 years back, there was a slogan from the Pathology Association saying that there is no medicine without pathology. So that is the bottom line. So definitely ethics should start from us, and we should, in the laboratory, we must be very ethical, because those 70% of cases are dependent on on the behavior of ours, the ethics of ours, and how we go about our testing in day-to-day life. So, as you have seen, in ISO 15189, which is the standard for medical laboratory requirements for quality and competence, here you can see in this book, which is guides us through the competency and quality of a laboratory. let's say, so this ISO 15189 has been inculcated into different accreditation bodies in different countries. Like in India, the NABL is very popular. Apart from that, there are 3 to 4 other organizations that also provide accreditation. Similarly, in Nepal, there is AERSSC, which provides local accreditation. And here, what I would like to let you know is in the first few pages, as soon as you start management requirements, this is clause 4.1, organization and management responsibilities. The very next page, it starts with general, then comes legal entity, and it starts with ethical conduct. So why have they put ethical conduct in the first page itself? Because that's how important it is. And with ISO 15189, within these 4 sentences here, 5 sentences, they have included everything that should be monitored in a laboratory in terms of ethics. So as Dr. Zubair has mentioned earlier, NABL or accreditation body would always like to know if if there was a training done on ethics. Is it regularly being done for the new recruits? That is very important. They would check on that. Then another thing would be ethical declaration, which also we have to be very careful of. What happens is, yeah, we had an NC long back regarding there was no ethical declaration from our staff. So what we did is we made a joint declaration and we closed our MC. But the better way to do is when you give a appointment letter to any joining staff, that time they should be explained on few things about ethics, and they should sign it along with the along with their joining letter. So that would be a more systematic way to have written consent from the staff that they have understood about the ethical conduct in the organization. And regular training is also very important on ethics. So there are 5 points which ISO 15189 covers regarding ethics. I'd just like to read go through this. So ethical conduct, laboratory management shall have arrangements in place to ensure the following. Before starting this, I would like to say that, in ISO, there is 1 sentence, but then the implication is maybe a whole book or a whole chapter, but then it's written in such a simple way, but it has a lot of meaning to it. So probably we might have to go through it also. So A, there is no involvement in any activity that would diminish confidence in the laboratory's competency, impartiality, judgment, or operational integrity. Second point, management and personnel are free from any undue commercial, financial, or other pressures and influences that may adversely affect the quality of their work. So this is also self-explanatory. Then where potential conflict in competing interests may exist, they shall be openly and appropriately declared. Fourth point, there are appropriate procedures to ensure that staff treat human samples, tissue, and remain according to relevant legal requirements. And finally, confidentiality of information is maintained. So it's just 5 points, but then there are too many things within these 5 points that you can elaborate this a lot. So after showing you that even ISO 15189, presenting to you that ISO 15189 also very much emphasizes on ethics, then I would like to discuss more relevant things in our day-to-day life, which is the principle of 3 principles of ethics as per the Belmont report, which was published probably 44 years back. So in our when we work, so this is what I would like to share with you, is that when we work, what are the things that should be guiding us in terms of ethics? So before this, whatever I have discussed is more on the history, what is ethics, and probably how ethics has been placed into ISO 15189. But whatever I will be discussing further are more relevant to us in our day-to-day work. So the 3 principles of ethics that we have to remember. So finally, this is the take-home message also. Respect beneficence, and justice. These three things are the basic principles of ethics in any field, even in medicine and especially in laboratory medicine also. So, so first we have to remember that it is the respect for the person. So, person as an individual, as a human, him or her having his human dignity, respect for the patient's decisions, respect for the patient's autonomy. Autonomy means his or her thoughts, intentions, actions before any procedures. And then the decision making should be free from any gentle persuasion of any kind, and fully informed consent with possible benefits and harm of the procedure should always be told to the patient, so this is a form of respect that you have been showing to the patient, which will be ethical. Second would be beneficence. So first is respect, second beneficence. This means, if in a short form I would like to say, it is do no harm, maximize benefit, minimize harm, and our duty is to act in the best interest of the patient. So we should protect and defend the right of others, prevent harm from occurring to others, remove conditions that can cause harm to others, help people with disabilities, rescue person in danger. So, these are things which we ought to do. That's what ethics is about. And third would be justice. So we should never, we should treat all the participants. If in case of research, we should treat all the participants as equal. If it's in a lab, if it's in terms of samples and all, we should respect everyone. I mean, whether if it's irrespective of their age, sex, gender, I mean, their racial backgrounds and all, those things should not come into place, and everyone should be treated equally. So, three things again I would like to reiterate: respect, which is respecting the patient; beneficence. Beneficence means doing what is right for the patient, and justice means giving equal opportunity to everyone. So, how does ethics? So, in laboratory medicine, as you know, there are five, pre-examination, examination, pre-examination, examination, post-examination, post-examination phases. But I would like to discuss on three phases: pre-examination, examination, and post-examination. So, in these phases, how does ethics imply in these phases in terms of respect, beneficence, and justice? So this is what I will discuss. In pre-examination phase, it is not it starts from the physician who starts ordering the test. Is he or she ethical or not? From there it starts. Sometimes, if it's an unethical person who is writing down tests, there may be a way by which we can convey to them that these things should not be done, or probably to a higher management. So it's unethical. The things can start from the doctor who is prescribing laboratory tests. And apart from that, it is the responsibility of everyone in the lab. It is not just the reception people, the phlebotomists, the technologists, technicians, senior technicians, doctors. No, it is everyone's responsibility to treat things ethically. So we have to keep in mind that in pre-examination phase, when you do things properly, it's always ethical. So when there is a deviation from what you ought to do, something unethical will definitely happen. So that's the simple way to remember. So proper phlebotomy has to be done. Proper patient identification is important, because this is respecting the patient also, and I'll show you examples. Proper labeling of samples, that is important, and appropriate handling of specimen till the test is performed. These are ethics in pre-examination phase. So when we talk of pre-examination phase, we first talk about respect, then beneficence, then justice. So when we talk about respect, we have to take consent. This is a way of showing respect to the patient. It may be in the form of expressed or implied consent. Expressed is when the patient is asked, I'm going to take your blood Are you okay with that? So this is, and the patient says, okay, I'm fine with it. So it is a verbal consent, or when you do a FNAC procedure, you take a written consent from the patient, you explain everything. So this is showing respect to the patient. So this is ethics, which is going on in the pre-examination phase. Implied would be when a patient sits down and voluntarily gives his or her arm, puts it in the collection chair, and then you go and draw blood. So this is implied consent. This is a form of respect that you have shown to the patient. Patient has the right to refuse the test and should be respected. So even in pre-analytical phase, patients say, no, I'm sorry. Probably after being poked 2 times, he or she says, I don't want to give the test. I'm sorry. Please get me a refund. So it's the right of the patient. We have to have functions, protocols in place to have the patient reimbursed and look into the matter. Then confidentiality of information is to be maintained in every step. This is so important because we had dealt with something like this. There was a young lady who was unmarried, and then she was in the reception area. She came for a pregnancy test, and there were other patients also around. And then what happened is from the reception, someone just called. The door to the lab was open, and then the patient heard someone inside our technologists talking that, oh, there's a young lady and she's 17, 18, and she's come for a pregnancy test, which they were talking inside was overheard outside. So that patient came and complained to us, and that was a very sad thing. So this is where respect to the patient. So we should never talk about the patient, and confidentiality should always be maintained. So anyway, we dealt with that scenario also. And in the pre-examination phase now comes beneficence. So doing no harm, doing the right thing. So all tests should benefit the patient based on the best medical evidence. So what happens is, a common example is patient comes around 2 o'clock, and then doctor has asked for a lot of tests, and then fasting or lipid profile is also there. So that lipid profile should be done in the fasting, and though it can be done in a non-fasting state also, usually it is done in a fasting state. But then you feel like if I let go of this patient, the patient may not come back, and I will lose probably 3,000 or 4,000 revenue of my institution. So you say, okay, it can be done, and then you just take it, and later on, patient had their meal 2 hours earlier, and the triglyceride is very high, and your calculated LDL is also haywire. So in that case, you are not doing justice to the patient. So this kind of thing should be avoided. This is just an example of how you should advise on the right timing and on the fasting of the sample also. Then comes SOPs, and training personnel should be in place to prevent any adverse events in collection procedures. So this is also covered in clause 5.1 personnel, wherein training and then competency of all the laboratory staff is evaluated 6 months or once a year, so that we do justice to the patient. So look how 5.1 is also correlated with ethics and beneficence to the patients. So that is how ISO 15189 works. So third, the collection procedure should be carried out using universal precaution to protect the patient and the healthcare worker, and should be performed by properly trained personnel. So, sometimes what happens is probably your let's say your cotton ball with alcohol, there is very less alcohol, and then you just didn't get time to go in and bring in alcohol. If you don't have a ready-made sachet, then you have to pour alcohol and mix it with the cotton. So then you didn't have time. So what you did is you just took a dry cotton and just do it like this, or probably you put it in saline and just cleaned it. So this is very wrong. You are doing harm to the patient. So this is also a commonly seen example. So that's why I put it here. Additional samples should not be collected for research procedures without informing the patient. This is very wrong. An example here, what I could share with you is, let's say there were a couple of patients whom we just took the sample for a routine test, and then we thought like we should do a test on lead on reproductive age group. So we selected probably ladies and gentlemen from 25 to 35 years of age, and then we just randomly did their lead levels checked. Now what happened is one of the patient has very high lead levels. Now what would you do now? Your moral says that that patient has very high lead levels, he or she has to undergo chelation therapy. Now, should I inform the patient or not? Your moral says that no, I should inform the patient because my heart says so. But then, in terms of ethics, you're doing a wrong thing because you should not have run the test. So ultimately, what happens is you or the institution will go into a legal suit with the patient because patient sample, your patient will be happy for a while, but then she might say that, why did you run my sample without my consent? So that's why, though it is a very good thing that you have done morally, you have informed the patient that, madam, you have this kind of problem, please go to a doctor, but then she will be okay later on, she will sue you. So that's why please make sure that these things are not done in the lab. Then transportation of sample should maintain the integrity of the sample. This is so important and so lacking in most of the countries right now because what happens is for a patient, once you go, so patients are not, patients do not worry about. I'm very sad. I'm very sorry to say, patients only do not, I should not say, they are more interested on the amount, how costly is the sample, because the test, because our in Nepal and India, most of the tests are not covered by insurance. So if when insurance coverage is not there, people have to pay from their pocket. So they are very particular about what is the amount, what is the amount, the test amount. So in this case, what happens is they look for cheaper places, and then now what happened is due to COVID, there have been so many transportation companies which have started transporting samples from the patient to the labs. So and now definitely with a certain amount and a commission in between, but then we should be sure that are they doing it the right way because the integrity of the sample is so important, especially in countries like ours, which is very hot and humid. In Kathmandu also, when it's very cold, it's fine. Otherwise, when it's a summer condition, it's very hot. And in that case, your sample deterioration is a very major issue that I have seen, which is not addressed by most of the people, especially business motivated people who are just transporting sample from one hospital to a laboratory to make money in between. So this we have to be very sure, careful of. And if you are accepting samples from outside to your laboratory, it is the accession area's duty to make sure that they transport the samples properly. Otherwise, you have the right to reject the sample because once you give out the reports, it's your responsibility. So pre-examination, finally, it's justice also has to be discussed here. Providing access to a wide variety of laboratory tests has a reasonable cost. This is justice. What happens is most of the labs, they would say that, oh, this is a very highly specialized test that we only are doing it. So why not just hike the price and let's make the most benefit out of it. This is very unethical, and this is seen especially in corporate hospitals, so and probably corporate run labs. So it's very unethical thing. And then again, doing justice in the pre-examination phase is evaluating the need to introduce new tests and then discontinue obsolete tests. Like vital test is no longer used. So if someone asks for it, we have it's our duty to let them know that there are other alternatives for a vital test. No preference given to individuals to facilitate or expedite the collection procedure at the expense of others. So this is self-explanatory. Now, from pre-examination, we go to examination. So, what are the ethics that are implicated in the examination phase? So, confidentiality, as I said, in any part of examination, quality and competence are very vital for all laboratory and settings. So how do you show respect to the patient in an examination phase? this, because you're not say looking at the face of the patient, no, but then you are respecting the sample of the patient. So patient have the right to decline to have their specimen analyzed even after the sample has been collected and processed. So you process it, but then you have not run it. So you have not of course, your some pre-analytical expenditure is there, but then before you put it into the analyzer, and if the patient wants a refund, it is you have to make a refund, and confidentiality should be respected and maintained. So this is a known fact. In examination phase, do no harm. So beneficence, how what is the role here? A good lab should involve the establishment of a rigorous quality assurance program encompassing quality control testing, proficiency testing, and laboratory accreditation. So I feel like what happens is if you are told to not to spit in a place, in a corner, let's say, please do not spit, it's written there, but then if there is no law, then you still have the tendency to spit there. But then if there is someone, there is a CCTV which is monitoring you, then you probably do not tend to spit there because you know that you are being monitored by someone. Similarly, in terms of quality assurance, quality
We are not
control.
able to hear you, sir.
Yes, sorry.
We are not able to hear.
Oh, really? Or how about now?
It's audible, sir.
Okay, okay, thank you. And so, in terms of, we need someone to be monitoring us. Otherwise, as I said, that in a corner, if you tell someone not to spit, someone may spit, but then if you put a CCTV there, they will tend not to spit. So, similarly, laboratory accreditation can work as a CCTV for our quality control and performance and assurance in the laboratory. Because at times, this is also something which is costly affair, laboratory accreditation, because you spend a lot on the quality control, on infrastructure, and also probably management may not be happy with that. So, but then we have to show them that these things have to be done by accreditation. So accreditation can be as a CCTV to be monitoring us. So this is for the beneficence or doing not no harm to the patient. So examination phase, let's talk about justice. So how can justice be placed in examination phase? All samples should be treated equally. Appropriate protocols for TAT and STAT samples should be defined. So this is also doing justice to the patient. If someone needs a report very urgently, so STAT samples should be done in STAT mode and should be monitored. It is expected that all samples, specimens are analyzed accurately and in a timely manner. So this is what you have to do. It's not that, yes, today I want to do quality, I do tomorrow. I don't have quality control, so I cannot run it. No. If you do not have a quality control external, then how else can you modify it to make sure that you are giving the right results? That is up to you, and you have to document it. So that documentation will be taken care, further evaluated by the accreditation body when they come for inspection. Should not temper reports or provide results without running the sample. This is again a very big problem in our part of the country, our part of the world. So where does ethics come into in terms of justice to the patient in examination phase? Very common example right now is COVID testing. You just have to pay. You don't have to get poked in your nose or your throat to have a COVID report. You just have to pay some money and then you get a COVID result. Very sad. Similarly, thyroid. Most of the labs, what happens nowadays is there are mushrooming of labs in the country, even in Nepal. Now you can see more than 4,000 labs just in Kathmandu, which is a very small place. And then, what happens is most of the labs I've seen is that they, rather than doing T3, free T3, free T4, and THS, they just run THS and then T3, T4 is just written down. So what happens is clinicians are also very used to seeing reports wherein THS, if it increases, T3, T4 has to decrease, and if THS decreases, T334 has to increase. So subclinical hypothyroidism or hyperthyroidism is not taken into consideration. And then when a genuine lab gives genuine results with an individually T3 only elevated with his T3 thyrotoxicosis, that lab will be marked as this is not a reliable lab, because doctors are also accustomed to see a very accurate reports in terms of THS going up, T3, T4 going down. So here, this is a very big problem. This should not be going on, and if it's going on, we have to advise to stop that. So finally, we go to the post-examination phase. Here also, all three things, respect, beneficence, and justice will be discussed. And so here first, sample storage and discarding protocols should be present. Biomedical waste management, this is very important. Ethics come here into post-examination phase. You know what happens? Most of the labs, when they discard the samples which has been processed or which has come out of the machine, or when they discard the samples, they do not autoclave it, they just discard it into, if there is no good monitoring system, they just give it to the municipality waste management. So there is very high chance of it, creating problems. Like for example, if there is a cholera, cholera has been diagnosed, and then you just throw it off in the water sink, that may cause other problems later on. Even community problems. So that's why biomedical waste management is very important. We should have policies on retention and destruction of medical records in a proper way. That should be there. Access to medical records should be identified. So this is also in post-examination. And then there should always be a consent whether the report can be given to the family members or any other person as required. So this is also comes in the post-examination ethics. So here we will again go through the three aspects of ethics. One is respect, then beneficence, and finally justice. So in post-examination phase, respect is confidentiality of result is the utmost importance. Should never discuss someone's results with others. And in this, so this is how you show respect to the patient. Patient have right to decide when and if the records or specimens shall be used outside the normal medical care to which they have consented. So it's up to them. And any further testing or residual sample should be provided by, should be approved by a local ethical body, then only it can be used. So this is respect shown in the post-examination phase. Doing no harm, beneficence in the post-examination phase. How is it implied here? So misinterpretation of results by unqualified personnel may cause harm to the patient. So the laboratory should have protocols on release of results, who can deliver the results over the phone, what is the read back, is there a protocol on that, do you document all the telephone conversations that were being done with the patient or the doctor. So these things should be written in protocol, and it should be clear that who is allowed to interpret the results. Test results must include, so these are things which must be included, like name, reference values, age, gender. One example I would like to give you is that for the benefit of the patient, whenever a child comes, alkaline phosphatase, the reference value for children is higher. So sometimes, some labs just give the adult value for a child, and then the patient's family also panics, and if the doctor is also not aware of it, he also would say that this is a wrong report, and they would panic. So in that case, you have to have the reference range of the child, of the children, to be placed whenever you release results. And patients should have timely access to the results. Delay should be avoided. This is very important. Now, relaying of critical results to patients or physicians on time is very important. This can be definitely it will be life-saving. And then please document this also. So this is the way you are doing benefit or no harm to the patient. and relaying additional findings. For example, you were only asked for a CBC, wherein you saw total count is a little low, and then when you had a look under the microscope, you identify blast. So it is you acting for the benefit of the patient, that we should not just be giving out the CBC count from the machine and just releasing it. If you see a blast, you can please comment on the blast or even give a count, manual count, and then release the results, and that can be conveyed. So this was not paid for actually, because the patient only paid for CBC, to complete blood count. But when we look at the smear, that is peripheral blood smear examination, the patient has not paid, but that does not mean that we do not release the report of the smear findings. So this has to be included. This is for the benefit of the patient, because here also what might happen is, I have seen cases like this. Where there was a doctor's brother who has been going around through many hospitals in Kathmandu for the past 1 year. He's lost weight, his hemoglobin was 5, but then only total count CBC was done with a machine and just released from most of the labs. Then finally, when he came to us, I had a look at his smear, and then he had all blasts. Then we did peripheral smear and give out the reports, and he's doing better now. Now, finally, justice in post-examination phase. So consistency in reporting is very important. Start reporting when required, and you cannot withhold a report because payment is an issue. So to avoid this circumstance, probably what you can do is probably have the patient at least pay 50% as per your institutional policies. And then in that case, if it's an urgent report, you cannot order any report if the patient wants and cannot pay. You should not withhold the report. So this is doing justice to the patient. So finally, take-home message would be 3 principles of ethics. This is the only thing that you have to remember, is you have to respect the patient. Beneficence means do no harm, do the best for the patient, and every patient should have equal justice, should be treated equally. And these are a few of my references. And I would like to thank you very much for your patient hearing. I would like to thank Devnopul for providing me this opportunity and having a platform where we can share things with each other. Dr. Zubair Hassan, who is a very kind and very learned doctor and colleague of mine, who initiated this along with his colleagues. I congratulate you and thank you too. And my staff and my doctors, colleagues from Samyak Diagnostics, who have always been supportive for me. And finally, thank you so much. And if any discussion we have, I would like to further discuss. Thank you.
Are there any comments? We have a lot of learned people here. I can see Dr. Neetu Madam has joined here. Neetu Samyak Madam is here. Dr. Rajni Madam is here. A lot of people are here who are very experienced in this topic of ethics. They would like to add anything. I would like to say that really I had a confusion in this ethics and these 3 concepts, but the way Dr. Keyoor has linked them with all the phases of the lab testing, I will not forget it again. Next time when I have to teach anyone, I would really link them, because otherwise the concepts are separate and practice is separate. You have really integrated them and taught them in a very nice way. I am grateful for that. Dr. Divya would like to say something. Dr. Divya is also a leading practitioner in Bangalore. She's upcoming pathologist, I can say. She's really trying to build her lab.
That's nice.
Yeah.
Thank you, sir. It was actually a really very nice presentation. Got to learn many things from, especially the difference between ethics, morals, and actually it will be very easy to practice in the same field.
Yes, thank you so much. Thank you so much. It's it's pretty boring topic, but it's so important that everything we do once we enter the lab till the time we leave, whatever we do, ethics can be correlated with it. So I'm also happy that Zubair gave me this topic, so I also got to read a bit on it.
Thank you. It's just really nice. Actually, we are put it in a very nice manner. So it was made very interesting actually.
Yes, thank you so much.
Anywhere.
Thank you.
And also, I would like to.
Good evening, Dr. Keyoor. Yeah, this is Dr. Rajni.
Good morning. Good evening, madam.
I'm sorry I joined late because I reached bed around that time. So I was driving, I couldn't hear to the first part of it. But anyway, yeah, I think it is very well put about the ethics, and one way the people can think and do it properly is every sample which comes to the lab is belonging to someone whom we know.
Yes.
I think that will take them a long way. Unless just, you think it is just a sample. No. I think that also, could add to. And one point on the BMW, which you commented on, wonderful. Yes, most of the labs don't do that. I think the segregation at the point of generation is very, very mandate. They should be taught right at that point where, the moment you get things, you discard it in the right color bag. That probably could help them in a long run, yeah.
Yes, madam. Thank you so much, madam.
This is Dr. Supriya, sir.
Yes, madam.
It was very nice and lucid presentation, very informative. So I learned a lot of points from this presentation. Sir, one thing I wanted to know, this report we are outsourcing and releasing in our own different lab name and all those things, that also comes under medical ethic and unhealthy practice. That
Yes,
was one point here to be added in this.
Yes, madam. Thank you so much. Yes, madam. That is also very important. And actually, when the inspectors come, they would look into this matter. And as madam has rightfully said, that either it should be transcribed in your letter pad, and then you have to attach the original report together, or just the original report should be released from whichever lab it has been outsourced to. But this is a practice which is not usually done because they don't want to disclose the name of the lab where they have been outsourcing. But it's against the law, madam. In Nepal also, if you are caught releasing reports after transcribing in your letterhead without attachment of the referred lab's report, then you can go into court. But that is a law, but it has not been implemented.
Thank you, sir. Thank you so much for.
Yes.
Kindly fill the feedback form. Please suggest what all topics you would like to have next. And also, we want more volunteers for becoming speakers for the next few sessions. So, if anyone is interested, they can directly message me as well. Divya, you can take over if you
Thank you very much, sir. In your busy schedule, giving the very nice talk. I thank each and everyone who are present here. Thank you.
Thank you very much.